Thank you for the introduction. As was mentioned, my name is Leonida Mutuku, and I work with a number of entities, but today I'm representing the Africa Open Data Network, which is a network of and for actors who believe in the continent's development agenda and the enabling power of data to achieve these development goals. Today, I'll be talking to you about my learnings from a study that we've been conducting over the past few months, trying to understand how open data can support effective anti-corruption strategies. Before I get into the presentation, the first thing I'd like to define is the term open data for those of us who are not necessarily familiar, and discuss how, and then throughout the presentation, we'll discuss how it can effectively be used to fight corruption during this pandemic. So open data is data that is produced in machine readable formats. So think about a CSV file or a JSON file and other formats. And this data is available to anyone to use without any legal, contextual, or commercial restrictions. That means no one will prosecute you if you decided to use this data in any format. So typically open data has been produced by governments and other public entities, primarily because the data that is held by governments about us is data that has been funded by taxpayer funds. And so we're entitled to it. And increasingly, we are seeing other private entities also opening up their data for whatever reason. So my colleague was supposed to be talking about open access, which ideally is what has really made it possible to have access to open data, because through the constitutions, at least in Kenya, and I'm sure in several other African countries, citizens have a right to information, and therefore governments are compelled to disclose different information about public affairs. So having said that, on the screen are three different stories that have been written in the newspapers over the past few months around instances of corruption that have emerged during this pandemic. So the first story talks about traders who actually made a fortune from supplying COVID-related supplies such as testing kits, personal protective equipment, and other supplies. So when the media dug deeper into when they were working on this story, one thing they realized is that some of these companies are owned by politicians and other civil servants. The second story is about cartels who've been hoarding testing kits imported from China and then used corrupt means to block locally manufactured testing kits and prevented them from passing quality standards so that they could win the tenders to supply these kits. And when you think of it, at the end of the day, who is losing? It's you and me, the common citizen, who is likely not just to suffer from the COVID disease, but also from what is inflicted upon us by corruption. The third story talks about early in the year, when the Ministry of Health was actually asked to account for 1 billion shillings, so that's about $10 million, that was given by the World Bank to support COVID-related efforts. And the Health Ministry was really hard-pressed to explain, for instance, why they were leasing ambulances for $400,000, when ideally you should be able to use that to purchase the ambulances. And please note that this was just 1 month after sorry about that. This was just 1 month after the funds had been released. Another instance was the misuse of funds, for instance, for tea and refreshments worth $40,000. So, this doesn't make sense right now when we look at, we have pressing issues and real need for this money. Next slide, please. So these examples I give refer to a phenomena that one of our esteemed human rights activists here in Kenya, Irungu Houghton, calls pandemic profiteering. That is, the procurement of supplies at inflated rates, or substandard quality materials. And basically we are losing because the government is expected to use money wisely and get us the most value for our taxpayer funds, and for also all this money being donated by other aid agencies. But given the limited oversight that is taking place during the pandemic, we are seeing that things are being purchased at inflated prices, and people are hoarding in order to create artificial supply issues, in order to undercut other opportunities. The second opportunity for corruption we've seen emerging actually is in allocation of social protection funds. I know some of you in your countries, such as here in Kenya, have been trying to find ways to really support those who've been economically affected by the pandemic. And so when there's no oversight or transparency in how funds are being spent, then we're not sure if these resources are reaching those who need them the most, especially the most vulnerable in our communities. In the same manner, we are seeing that people who need access to ICU facilities and other healthcare facilities right now are being looked over maybe those who can afford to pay just a little bit more, so bribe their way through in order to get first priority for these limited resources. And so of course, this is a moral hazard that is arising from these corruption issues. And therefore, there's a need that us as civil society and government champions to figure out how we can create a more transparent and accountable mechanism towards ensuring transparency in these COVID-19 response efforts. Next slide. So here's where open data really becomes an interesting tool that is at our disposal, and that enables us to really support transparency in COVID-19 related procurement. So for instance, in Kenya, we have two portals: the beneficial ownership portal, which in other countries might be your company registry, and an open contracting portal. In fact, the stories that I shared earlier on in this presentation would not have been possible if journalists were not able to access open data, for instance, such as the company's registry, and find out who is being awarded these contracts and which tenders are in place to really, to supply COVID-19 related material. So through such open portals, data is shared about who has won these contracts and how they were qualified to meet the expectations to execute the contracts. And as citizens and civil society, we can actually start querying through these portals what is expected quality of products to be procured, and what is the track record of the companies who are getting these contracts. On the other hand, through the company's registry or a beneficial ownership portal, we are better able to understand how the companies that are winning these government contracts to supply emergency response resources are being run. So are they owned by politicians? Who really is behind these companies? And what is their motivation, if not pandemic profiteering? One of the articles actually stated that some of these companies were set up just 30 days ago, or 30 days before they won the contracts. And so there's no certainty that they were competent or had the capacity to execute the contracts to supply COVID-related material. The other thing that we get to hear a lot from our agencies and the judiciary is that there's likely no evidence to prosecute people who are charged with corruption. So when we are able to access open data from such portals and other open data sets, then it's easy to use this data as evidence. However, this is where political will is required and effective judicial systems are necessary. based on the evidence that is being put forth from the open data, then it's easier with the political will and the necessary systems in place to prosecute those who have been found guilty of corruption. So then what else can we do, especially as civil society who might not be seated in government right now? Most of our countries have set up task forces that are mainly government-led and include private sector actors to galvanize efforts to fight this pandemic. With open data, as civil society, it is very imperative for us to keep these task forces accountable and ensure that they are publishing and tracking the donations that the government has received, how they're using these funds, and the reasoning behind the various allocations that have been made. In Kenya, Article 19 has set up a very interesting portal called the COVID-19 Age Tracker, and the link is on the presentation. And this portal uses data both collected from access to information requests, media reports, as well as published exchequer releases from the Treasury to compile how much money has actually been pulled together for pandemic response. So it's a really interesting open data set that, and it's very visual portal that you can use to reference just how much money, for instance, in Kenya, has been allocated to fight the pandemic and to support recovery efforts. So once you know how much money is at stake, the next step is to continually push for the Treasury and other relevant bodies such as the Ministry of Health to proactively publish how these funds are being used and spent in an open manner so that we can continue keeping them accountable and transparent and help our citizens and the country generally to respond and recover effectively from this pandemic. I'm happy to answer any questions about some of these strategies later on. Thank you.